And I think that speaks to the people that are terrified of getting the test and
Yep.
maybe are not going to get tested because they're listening to what people are saying. I mean, of course, I'm joking when I say, I felt like a Pez dispenser. I did survive it.
Yep.
So, you need to get a test, go get your test by all means. But if you are a person who maybe leans on the side of anxiety, particularly when it comes to things medical, that they need to come to you because you're just going to place it right there in the start of the nose, and they'll know very quickly, according to what you're saying, as far as getting the results back, which I think is great for another reason, and that many people are getting their test and then during the waiting period they're quarantining, right? Just in case. So maybe they don't have to wait 5 to 7 days now to do that. And if it's only 24 hours, that's really going to solve a lot of problems for a lot of people.
Well, I don't want to put any confusion out there. It's 24 to 72 hours, depending on when the lab receives the specimen and if the specimen runs correctly. And so it could be up to 3 days. But we're working really hard to cut that down so that we have the point of care testing in-house. Our lab is capable of running it. We're supposed to be getting all of our machines in this month and then all of our test kits in by next month. And if that were to happen, then we'll be able to run the test in-house and be able to get patients' results back to them within 15 minutes. And it's the same test that's ran at the big labs, right? So it's all PCR RNA testing that we're doing. Even the in-house will be PCR RNA testing.
It's still quick, no matter how you look at it.
It's still quick, no matter how you look at it. That's right.
Yeah.
Well,
Now,
I was just going to say that, the other thing we're trying to do to make it comfortable for the patients and also protect them and our staff is the test has to be ordered by a physician, but they go online, they do a telecare visit, they just book online through our website, can do a call similar to this with the physician, give them their test or explain how they think they were exposed to COVID. The physician orders the test, we set a specific time, and then we go right out to the patient's car and test them so they don't have to come in. They don't get exposed. Our staff doesn't get exposed. Like you said, I've had that exact test you've had for flu, and I know exactly what you're talking about. It's not real comfortable, but this is much more comfortable and really protects the patient, makes it super easy for them, and they get it all done in their car, and then we call them back with the results, or we provide them a sheet where they can log in and get their own results.
it's fantastic. I love so much about what you guys are doing. I love your approach. I love just everything that you're saying. And, you guys, we talked about anxiety. Dr. Harris, I'm sure you know this as well. Anxiety is through the roof with people right now. And, I've met with psychiatrists and different people on the program, and we're all saying the same thing. And I used to be a psychotherapist, so it's a hot button for me. But we're looking at possible cases of PTSD as a result of all of this. Anxiety, depression, all of those things. And then you compound it with, oh, by the way, you might have COVID, and now sit here for 5 or 7 days and wait to find out, what's going to happen. And by the way, when you go get the test, it's going to be miserable, and you've read everything on social media, and you don't even want to go now because you're fairly sure that it's going to off you in the parking lot. So this is very, very different. And I know that you'll have a lot of people who want to come to you for that reason, but also for so many other reasons. As I walked through the clinic and I saw just so many things I think that are different from other urgent cares, and it was great. And you're right, Tim, about the staff. They are so friendly and so knowledgeable. One thing that I learned as I walked through was about your screening and your drug screening. And if you can speak to that for a minute, because for our employers who are looking to hire people, talk a little bit about that drug screen that you guys have and the process to make sure that people can't get away with anything, or it's tremendous.
Sure, we do at a lot of our locations, and Dr. Harris can jump in here too, but at all of our locations, we do a lot of occupational health, which includes pre-employment drug screening or DOT drug screening or what have you after accidents. One of the machines we have there is called eScreen. So, well, first of all, we have a special lab testing area for drug screening so that nothing can be hidden in the room. It's a dedicated bathroom just for it. We control the flushing, all that. So we make sure that when someone comes in to give a sample, we get a true sample and it's not something that was brought in. Believe it or not, that does happen. You can actually buy stuff online. So we've taken great steps to make sure that that doesn't happen with us. And the e-screen machine is kind of an instant reader as well. And for the employers, it's a great thing because it immediately sends them an email with the results as soon as it's done. So they don't have to wait for us to call back. It also posts it in a portal that they can access that has all their employees who have tested with us through eScreen and have done other things too. You can do other different things that, DOT physicals and things in there, but it keeps the chain of custodies and all that online. So it's very easy for the employer to access it and then also go back and re-access it when they want. Keeps a real record for them. So that's one of the, the state-of-the-art kind of things that we try to do to keep things as electronic as possible. Still, of course, making sure that we maintain all HIPAA protocols so that everything is private and everything is shared. But so we do those things. We do DOT physicals. We do workers' comp, all those kind of things for the different employers. And we have a special billing coordinator that just works with the OC Health accounts to make sure that their billing is smooth. They have one contact if they have a question about the bill. So it just makes it, we try to make it easy on the employer, because this thing, for the people who handle it, especially if you're not a huge company, but even if you are, there can be a lot of things that makes your job more difficult if you're that person. We try to simplify that as much as possible, make it easier.
It's wonderful. And I know that when I did the tour and the nurse was saying, the employer can get these results back in maybe up to 15 minutes. I mean, it's fairly instantaneous. So as soon as it runs, there they've got it right there. The beauty of that is that a person who's out of work and let's say we have an employer in town who is promoting, I can get people to work in 2 hours. We can get done with their paperwork in 2 hours. They send them to you. Well, they're already working by the afternoon. That's a tremendous benefit for our community.
That's really true. Very much so. We hear that a lot. And, especially if they're negative tests. If it's positive, then we have to resend it out to the lab and such. But at that point, that you can't put them to work anyway. But, but what you're really looking for is just to make sure your people are negative and they're good to go. So, so that's what the whole system is designed to do.
But, let's say we've had people that have been furloughed or laid off for the past 2 months, and they've now, maybe they can't get by on what's left of the unemployment, and they've got to get back to work, and they found something, and their kids are hungry, and they're thinking, look, I don't have another month to try to get employed somewhere. And so they come to you, and they're good to go. They're working by tomorrow morning. Their kids are now fed. I mean, it's a bigger thing than I think people realize.
You're exactly right.
All right, Dr. Harris, last things maybe you want us to know about the clinic. Talk to me a little bit more about why it's so special and why people need to come to you and your urgent care above anybody else.
Well, I think Tim hit on that in the beginning, right? I mean, look at the Google reviews, right? I think we just provide a super clean, welcoming environment that is affordable and quick. One of the things that we do watch with our providers is their turn times, right? And so we want to see that the clinic and the providers are providing top-notch health care, which I look at charts all the time. I'm in my office doing chart reviews constantly to make sure that everybody's doing best practice and everybody's doing evidence-based medicine. But we really want to get people back to work, get people back to whatever they were doing, right? So we strive very, very hard to keep our turn times, meaning from the time the person walks into the door until the time they leave, under 1 hour, under 60 minutes. And on average, we're at about 45 minutes whenever you look at those things throughout a year's time, right? During flu season, it is a little bit longer, and we do provide a little bit cushion because we're much busier. But I do think that's one of the things that that separates us from most. People aren't going to wait a long time when they're in the clinic. And right now, we have very good access to telehealth. So if you have to come into the clinic, we're keeping it very safe. We've got chairs take off so that people can social distance when they come in. It is required that everybody wears masks. We're keeping people safe, keeping others away from each other. So there's not going to be a direct exposure. And then we do provide very good directions online. So if you go through our website of how to do telehealth for people that don't feel safe coming in, and those appointments will be had at the time that you're there, because we have enough people working and helping out. So if one center is busy, another doc, another center may help pick up telehealth from that center, or I'm here in my office and I may help pick up telehealth from. So we are able to provide an efficient, cost-effective, best practice, evidence-based care.
When people don't feel well or they're hurting, the last thing they want to do is sit in a clinic for 6 hours.
That's right.
And so that is awesome. That, I mean, an hour, 45 minutes, an hour, that's fantastic.
Well, employers don't want their employees leaving for 6 hours either. So, literally people can come out on their lunch break and get back to work and may not even have to miss much time on the clock. But we recognize that, and we think it's important for the community, and we strive very difficult. We strive very hard to stay within those parameters.
Absolutely. All right. How can we get a hold of you? What is the website? What is the phone number?
For the Clemson location, it's AFC Urgent Care Clemson.com. And I don't have the phone number off the top of my head, but it's on the website there. Can't remember all 7 of them. But anyway, that's the quickest way to get all the information. That's where you can book the telehealth visits. Back to one other thing with the employers is we don't just have a cookie cutter approach, but when every employer has different protocols about how they want to handle work comp or drug screens, we take all that information, customize it in our system to that employer. So we don't try to put them into our system and cram them into that system. We try and adapt ourselves to whatever their needs are. So that would just be the other thing I'd like to put out there for the employers.
Absolutely. It all sounds great, and I encourage everybody to go to AFC Urgent Care. Gentlemen, thank you. I'm Joanne Johnson, Executive Director for the Oconee County Chamber of Commerce. This has been another segment of What's the Buzz? And today, again, I've been interviewing and stumbling all over my words. Okay. I have been visited today by Tim Groves and Dr. Jeffrey Harris. I thank you all, and we will see you next time. Have a great day, everybody. Bye-bye.
Thank you, Joanne.